Your heart is the only organ in your body you can actually feel working. You don't feel your liver functioning. You don't feel your kidneys filtering your blood. But your heart, that tireless muscle beating more than 100,000 times every single day, you feel it. And when it changes rhythm, when it speeds up without any apparent reason, when it seems to skip a beat or suddenly race out of control, your entire body notices. I know exactly what people describe when they come in with this problem. Some say it feels like a bird frantically flapping its wings inside their chest. Others say the heart seems to freeze for a split second, then comes back with too much force. There are those who wake up in the middle of the night with that strange feeling that something is wrong. No pain, no clear reason, just that unsettling irregular rhythm in the chest that won't let them sleep. And almost everyone arrives with the same sentence: "I thought it was just anxiety." And it might be, but it might not be. That is exactly where the danger lives, in that gray zone between what seems temporary and what is already signaling a real problem with your heart. Because a racing heart, what medicine calls cardiac arrhythmia, doesn't always shout. Sometimes it whispers. And those who don't know how to listen ignore it, until the day it can no longer be ignored. After more than 20 years inside hospitals and clinics, following patients with arrhythmias closely, I have seen simple cases resolved with a single lifestyle change. And I have seen cases that came in too late. What separates those two outcomes, in most situations, is not the severity of the initial problem. It is how well the person knew their own body and whether they could recognize the signals it was sending. That is why this video exists, so that by the time you reach the end, you will know how to identify what is happening when your heart races, why it happens, what may be causing it, and what you should do, right away and in the long term. Pay close attention, because what comes next may genuinely change the way you take care of your heart for the rest of your life. Before we go further, I want to ask you something quickly. If you are not yet subscribed to this channel, do it right now. Here, we bring you content grounded in science, explained clearly so that you can make better decisions about your health, not out of fear, but out of knowledge. Click the subscribe button and tell me in the comments where you're watching this video from. We have people from more than 40 different countries following this channel, and I genuinely love knowing where each one of you is coming from. Now, let's get into what really matters. The human heart has its own electrical system. That system coordinates every single heartbeat. It sends the signal to the muscle to contract at exactly the right moment, in the right sequence, with the right force. When everything is working well, this system operates in silence, like an invisible conductor making sure the orchestra plays in perfect harmony. You don't think about it. You don't need to think about it. The heart beats. The blood flows. Life goes on. But when that electrical system suffers any kind of interference, whether the origin is internal or external, the rhythm breaks down. The heart may begin beating too fast, too slow, or in an irregular pattern, losing its proper tempo. And that is precisely what we call a cardiac arrhythmia, any alteration in the normal rhythm of the heartbeat. The word arrhythmia comes from Greek and literally means without rhythm. It covers an enormous family of conditions, from the simplest and most benign, like premature beats, those sensations of an extra or skipped heartbeat that almost everyone has experienced at some point in their life, all the way to complex and potentially fatal arrhythmias, like ventricular fibrillation, which can lead to cardiac arrest within minutes. This is the first thing I want you to understand. Not every arrhythmia is an emergency, but no arrhythmia should be completely ignored. The most common mistake I observe, and I see it repeated with a frequency that genuinely concerns me, is someone feeling their heart race, waiting for it to pass, and when it passes, breathing a sigh of relief and seeking no medical evaluation whatsoever. It passed, so it must have been nothing. That reasoning can be fatal, because some of the most dangerous arrhythmias are exactly the ones that come and go, that appear for a few minutes or a few hours and then disappear as if nothing happened, leaving the person with the false sense of security that everything is fine. Let me give you an example that captures what I mean. One of the most common arrhythmias treated today is called atrial fibrillation. It occurs when the atria, the upper chambers of the heart, begin vibrating chaotically instead of contracting in an organized way. The result is a heart that beats irregularly, often at an accelerated pace, unable to pump blood with maximum efficiency. Many patients describe atrial fibrillation as a sensation of the heart being scrambled, as if it is trying to beat in several rhythms simultaneously. And do you know what the truly alarming detail is? A significant portion of people who have atrial fibrillation feel absolutely nothing. The arrhythmia is happening, the heart is in electrical chaos, and the person is at home, at work, sleeping, with no idea whatsoever. They only find out during a routine electrocardiogram, a checkup visit, or, tragically, after suffering a stroke. Because atrial fibrillation increases the risk of stroke by up to 5 times, as blood pooling inside the atrium can form clots that travel to the brain. 5 times the stroke risk, and many people are living with this condition without knowing it. This is precisely why early diagnosis matters so much. This is why understanding the signals the body sends, even the subtle ones, even the ones that pass quickly, can literally save a life. Now let's talk about causes. Why does the heart fall out of rhythm? What interferes with such a precise electrical system? The answer is many things, and some of them are far more common than you might imagine. The first cause I want to highlight is stress and anxiety. When you are under stress, whether it is pressure at work, an emotional conflict, a scare, or an intense worry, your body releases adrenaline. This hormone is a survival tool. It speeds up the heart, raises blood pressure, and prepares the body to react. In isolated situations, this is completely normal and necessary. The problem arises when stress stops being isolated and becomes chronic. When adrenaline circulates at elevated levels continuously, the heart's electrical system is overstimulated on a constant basis, and that is when arrhythmias start appearing more and more frequently. I have followed people with structurally perfect hearts, no detectable cardiac disease whatsoever, who developed significant arrhythmias solely because of the chronic stress they were living under. The heart was healthy. It was the life they were leading that was making the heart sick. The second cause is excessive consumption of caffeine and other stimulants. Caffeine, in moderate doses, is safe for most people, but in excess, and what counts as excess, varies from person to person. It can trigger palpitations, tachycardia, and arrhythmias. This applies equally to energy drinks, thermogenic supplements, certain weight loss medications, and even large amounts of certain teas. I always ask about stimulant consumption before concluding any arrhythmia evaluation, and I am consistently surprised at how often that turns out to be the missing piece of the diagnosis. There have been patients who arrived at the emergency room with a heart rate above 160 beats per minute, a number that frightens anyone, and the cause was a combination of 3 energy drinks and a pre-workout supplement taken during the same afternoon. Once the stimulants were removed, the arrhythmia disappeared completely. The third cause is structural cardiac problems. Here we enter more serious territory. Diseases that affect the physical structure of the heart, such as heart failure, coronary artery disease, valve disorders, cardiomyopathies, and the aftermath of a heart attack, can damage or alter the heart's electrical system, creating abnormal electrical circuits that generate arrhythmias. In these cases, the arrhythmia is not the disease itself. It is a symptom of something larger happening in the heart muscle, and treating only the arrhythmia without addressing the underlying cause is like turning off the fire alarm without putting out the fire. The fourth cause, and this is one of the most underestimated, is electrolyte imbalance. The heart's electrical system depends on specific minerals to function correctly. Potassium, magnesium, sodium, and calcium are the main ones. When these minerals fall out of balance in the body, whether due to inadequate nutrition, the use of diuretics, intense diarrhea, frequent vomiting, or excessive sweating, the heart loses part of the chemical foundation it needs to conduct its electrical impulses in a stable way. Magnesium, in particular, deserves special attention. Studies show that a large portion of the population consumes less magnesium than needed, and deficiency in this mineral is associated with an increased risk of arrhythmias, muscle cramps, insomnia, and anxiety. It is no coincidence that many people who live under chronic stress, sleep poorly, and frequently feel their heart racing show low magnesium levels when tested. The body is calling for help in several ways at once, and we need to know how to read those signals. The fifth cause is certain medications. This surprises many people, but it is an important clinical reality. Some medications, especially when used at incorrect doses or in combination with others, can provoke arrhythmias. Antidepressants, antihistamines, antibiotics of certain classes, blood pressure medications, and even some medications for gastric problems appear on this list. Never, and I mean never, adjust or stop a medication on your own based on this information. What you should do is speak with the prescribing physician and report any new symptom that appears after beginning a treatment. The sixth cause is hormonal disorders. The thyroid is the most classic example. When it is overactive, producing excess hormone, what we call hyperthyroidism, the heart accelerates. The person experiences palpitations, anxiety, unexplained weight loss, excessive heat sensitivity, and trembling in the hands. The heart is responding to the excess circulating hormone as if it were in a state of permanent alert. Equally, changes in sex hormones, such as those that occur during menopause, can also trigger episodes of palpitations and tachycardia that confuse and frighten many women who do not understand what is happening in their own bodies. Now, let's talk about symptoms. Because recognizing what the body is saying is half the way to the correct diagnosis. The most obvious symptom is the one that names everything, the sensation of a heart that is racing, pounding, beating strongly or irregularly. Patients describe it in different ways. Some talk about their heart in their throat, others about a heart that is jumping, others still about a strong beat that you can feel all the way up in your neck. All of them are describing variations of the same experience, the conscious perception of a heartbeat that has stepped outside its usual pattern. The second symptom is shortness of breath. When the heart is not pumping blood efficiently, whether because it is beating too fast to fill properly or because it is beating irregularly, the tissues receive less oxygen than they need. The result is that feeling that the air is simply not enough, even though there is no lung problem whatsoever. It is a type of breathlessness that frightens precisely because it seems to have no obvious explanation. The third symptom is dizziness and the feeling of fainting. When blood flow to the brain decreases, even for a few seconds, even slightly, the person feels the room spinning, their vision darkening, their legs weakening. In more intense cases, syncope may occur, which is an actual loss of consciousness. An arrhythmia that causes fainting is always an arrhythmia that needs to be investigated urgently. The fourth symptom is chest pain or discomfort. Not every chest pain is a heart attack. Far from it. But chest pain associated with an irregular or accelerated heartbeat is a warning signal that demands immediate evaluation. A heart beating abnormally may struggle to irrigate its own coronary arteries adequately, generating that sensation of pressure, tightness, or burning in the chest that patients so frequently describe. The fifth symptom is unexplained fatigue. This is one of the most overlooked, because most people attribute excessive tiredness to their pace of life, stress, or lack of sleep, and many times that is exactly what it is. But when the fatigue is persistent, when a person grows exhausted doing things they used to handle without difficulty, when the body seems to have no energy even after rest, that may be the heart functioning below its capacity because of an arrhythmia quietly undermining its performance. The sixth symptom is anxiety associated with the irregular heartbeat. This one is fascinating from a clinical standpoint because it creates a self-reinforcing cycle. The arrhythmia generates anxiety. The heart races. The person becomes frightened. The fear increases. And the anxiety, in turn, worsens the arrhythmia because it releases adrenaline, which stimulates the heart's electrical system even further. Many patients arrive in a state of full panic, convinced they are having a heart attack, when in reality they are caught in a cycle of anxiety and palpitations feeding one another. Understanding this mechanism is fundamental to breaking the cycle. And then there are silent arrhythmias, those that produce no perceptible symptom whatsoever. The person lives normally, feeling nothing, while the heart beats irregularly for hours, for days, sometimes for weeks. These are the most treacherous, and they are discovered more often than not by chance during a routine electrocardiogram, a checkup visit, or tragically after a serious complication has already occurred. This is why regular medical follow-up is not optional for anyone who wants to keep their heart healthy. It is not paranoia. It is intelligent prevention. Now, I am going to tell you what to do when you feel your heart start racing. I am not talking about distant theory. I am talking about practical, evidence-based guidance that can make a real difference in the moment it happens to you. The first thing is to stop what you are doing and try to calm yourself. Sit down. Breathe deeply and slowly. Inhale through your nose for a count of 4. Hold for 2 seconds. Exhale through your mouth for a count of 6. This controlled breathing technique activates the parasympathetic nervous system, which is the system that breaks the heart. In cases of tachycardia driven by stress or anxiety, controlled breathing can interrupt the episode within minutes. The second recommendation is to observe the duration and frequency of the episodes. How long did it last? How often is it happening? Was the heart irregular or just fast? This information is extremely valuable for the physician who will evaluate you. If possible, write it down. The time, the duration, what you were doing when it started, whether you had consumed caffeine or stimulants, whether you were under stress. The third recommendation is to avoid stimulants during the episode and in the moments that follow. Do not drink coffee. Do not consume energy drinks. Do not use pre-workout supplements. Give your heart the chance to return to its rhythm without adding more fuel to the fire. The fourth recommendation, and this one is fundamental, is to seek medical evaluation if the episodes are frequent, if they last longer than a few minutes, or if they come accompanied by other symptoms. A cardiology consultation, an electrocardiogram, and possibly a 24-hour Holter monitor, which is a continuous recording of your heart rhythm throughout an entire day, are the first steps of an appropriate investigation. And the fifth recommendation is to seek emergency care immediately if you feel chest pain associated with the racing heart, if you faint or feel like you are about to faint, if you have intense shortness of breath, or if the episode lasts more than 30 minutes without improvement. In these cases, do not wait. Do not try to manage it at home. Go to the emergency room or call emergency services. Now, let's talk about treatment. And here I want to clear up a myth that circulates widely. There is no single treatment for arrhythmia. What exists is a set of approaches that the specialist will select and combine based on the specific cause, the type of arrhythmia, the intensity of the symptoms, and the general health of each individual patient. For arrhythmias caused by stress and anxiety, treatment may begin with lifestyle changes, relaxation techniques, regular moderate physical activity, improved sleep, reduction of stimulants, and sometimes psychological support. Consistent studies show that regular physical activity, not the intense and exhausting kind but the moderate kind practiced consistently, has significant protective effects on heart rhythm. A well-exercised heart develops a greater capacity to recover from rhythm variations. For arrhythmias associated with electrolyte imbalances, mineral supplementation, especially potassium and magnesium, may be sufficient to resolve the problem. This can be achieved through dietary adjustment, with foods rich in these minerals, or through medically guided supplementation. Do not supplement on your own. Excess potassium, for example, can be just as dangerous as a deficiency. For arrhythmias caused by hyperthyroidism or other hormonal disorders, treating the underlying disease resolves or significantly improves the arrhythmia. The heart was responding to an altered hormonal environment. Correct the environment and the heart tends to return to rhythm. For more complex, structural, or persistent arrhythmias, the cardiologist may prescribe specific antiarrhythmic medications, which act directly on the heart's electrical system to stabilize the rhythm. These medications require rigorous monitoring because they have narrow therapeutic windows. The dose that treats can also cause problems if it is not precisely correct. In selected cases, more advanced procedures exist. Catheter ablation, for example, is a minimally invasive technique in which the specialist identifies and eliminates the point in the heart generating the abnormal electrical circuit responsible for the arrhythmia. The results, in experienced hands, can be genuinely transformative. Patients who had lived with frequent episodes of tachycardia can become completely free of symptoms after the procedure. There is also the implantable cardioverter defibrillator, which is a small device placed under the skin of the chest, connected to the heart by thin leads, that continuously monitors heart rhythm and intervenes automatically if it detects a dangerous arrhythmia. It is a technology that literally saves lives in patients at risk of fatal arrhythmias. And there is the pacemaker, for cases where the heart beats too slowly, the bradyarrhythmias, in which the device takes over the function of stimulating the heart muscle to beat at the appropriate rhythm. The essential point is this: medicine has tools. Tools that are increasingly refined, increasingly precise, and increasingly less invasive. But all of these tools can only be used if the problem is identified, and the problem is only identified if the person seeks evaluation. You, watching this video right now, have an enormous advantage over those who do not have this information. You know what an arrhythmia is. You know why it happens. You know how to recognize the symptoms. You know what to do when you feel your heart fall out of rhythm, and you know that effective treatments are available. That is not a small thing. That is exactly the kind of knowledge that, at the right moment, makes all the difference. I want to leave you with something I have carried with me since the earliest years of medical practice, and that has only deepened with time and with every patient I have accompanied. The human body is extraordinarily communicative. It speaks all the time, through symptoms, through signals, through subtle changes that most people have simply never learned to interpret. A racing heart is one of those communications. It may be a simple sentence with a quick and easy response. It may be the beginning of a longer paragraph that demands attention, investigation, and care. But it is always a message that deserves to be heard. Ignoring what the body says does not make the problem disappear. It makes it grow in silence until it can no longer be ignored. And at that point, the treatment options are often fewer and the road back is longer and harder. The heart you have is the only one you will ever have. There is no replacement, no backup version, no second chance for many of the mistakes we make with it throughout our lives. What does exist is the possibility of caring for it, now, consciously, with knowledge, and ensuring that this extraordinary muscle continues functioning at its best for as long as possible. Information is protection. Attention to the body's signals is prevention. And regular medical follow-up is what transforms risk into control and fear into peace of mind. If you have watched all the way to this point, you have already taken an important step. You chose to prioritize your heart for a few minutes. I invite you now to continue on that path. Subscribe to this channel because every week we bring new content like this one, grounded in real science, explained clearly and honestly, without alarmism and without oversimplification. Turn on the notification bell so you never miss a video. Share this content with someone you love who needs to hear what was said here today. Because information that saves lives should never stay hidden. And tell me in the comments, Have you ever felt your heart race like this? What was your experience? Where are you watching from? I read the comments, I respond, and every story shared here can help someone else going through the same situation. Take care of your heart. It is beating for you right now. Give it back the same attention. See you in the next video.